Welcome to The Cutting Edge. I'm Zima Creason, Executive Director of the California Edge Coalition. The Cutting Edge is our interview series where we connect with leaders to discuss a range of topics related to workforce development, education, and training. Today, I'm excited to welcome Carmela Coyle, President and CEO of the California Hospital Association. CHA has been a long-time member of the California Edge Coalition. Welcome, Carmela.
Thank you so very much.
So let's dive in. Can you tell us a bit about CHA's mission and 2022 priorities?
Sure, thank you. The California Hospital Association's mission is really pretty simple. It's all about helping hospitals help people. Our hospitals, about 400 of them in the state of California, work every day to care for their communities. And while we think of hospitals and the acute care they provide, it's also about prevention and wellness and outpatient care and all the rest. So we represent those hospitals, both in Sacramento and in Washington, D.C., to try to make sure that laws and regulations really allow them to do the best they can to care for their communities. In terms of our agenda this year, you won't be surprised to hear that topping the agenda is workforce, workforce, workforce. I know we'll talk more about that later. So we are focused on strengthening hospitals, especially during this pandemic. We have lost significant numbers of workers. We've got to build them back. And hospitals have lost their financial stability. We've got about 60% of California's hospitals who are operating right on the financial edge, many who are operating in the red. And so we are looking to provide financing for those hospitals to stabilize them. We're going to be focused on disaster preparedness. We have just been through 2 years of things we've never experienced before. We want to make certain we're ready for the future and that other disasters like seismic events are events that we're prepared for and that are affordable as we move ahead. Behavioral health continues to be a top priority for us. We have a woefully inadequate behavioral health system in the state of California, and many people, as a result, end up in hospital emergency departments, which are not the best or right place for them to get the care that they need, and many other things. So those are just some of our top priorities.
Oh, just a very light load, right? And we can't survive without you. So I'm so glad that we're in partnership to advance shared goals. Just so appreciative of the work that you and CHA is doing. And you touched on this a moment ago, workforce shortages in healthcare are a major area of concern. This has been the case way before the endemic, and of course, much worse now. Can you share how CHA is working to address these challenges and how state policy and investments can help?
Workforce challenges have never been greater. You're right. We had workforce challenges before the pandemic. But what's happened now is it has escalated to levels that we've just never seen. We are down 20% in terms of the healthcare workforce. It's extraordinary. Some have said, how much of that has to do with vaccine mandates? The answer is very little. We lost about 1% of the hospital workforce due to vaccine mandates, folks who didn't want to do that. But the 20% loss has everything to do with the moral injury that our workers, and right, there is no healthcare without healthcare workers, the moral injury that our workers have gone through in this pandemic. I was just with one of our large systems yesterday, and the mortality in the intensive care unit went from 6% to 33%. Just think of that for a minute, from basically 1 in 20 people in the ICU dying before COVID to 1 in 3 people in the ICU dying during COVID. That has put such stress, such strain, and such injury to our workers. So workforce is job 1, 2, 3. We are looking at a whole series of options that will help us in the short term as well as the long term. Our immediate challenges in the short term, right? We can't educate people overnight. And so what can we do to attract workers to the state of California? We're a very high cost state. What can we do to create the flexibility we need short term to care for everybody who needs that care. And then in the longer term, really looking at ways that we can grow the number, not just of nurses, but other allied professionals. And that is through increasing faculty, increasing slots, increasing interest in these jobs. And our concern is that interest has waned in the face of this pandemic and some of the images that people have seen.
You hit on something I would love your clarification on. Are we calling COVID-19 a pandemic or an endemic now? What's the appropriate wording?
Sure. COVID-19 is still a pandemic. I think we have people who are hoping for an endemic state. So pandemic, right, this is still raging. We will likely surge again. Hope that doesn't come true, but the likelihood of this virus continuing to mutate and therefore new strains that are dangerous is highly likely, as long as we continue to have people who are unvaccinated. The virus is attracted to those who are unvaccinated, and it gets a chance to mutate. And I think what the pandemic has meant for us is we can't have blinders on, right? We can't just look at it from the perspective of California or even the United States. As long as we have countries around the world that have lower than desirable vaccination rates, we will be vulnerable to new strains, new variants, and those can pop right back into the United States as we have such a mobile world population. So we're going to be on watch for some time. I think many of the scientists who are watching this closely are hoping for an endemic state, basically when the virus is still around, but we have controlled it as best as we can. It doesn't mean there won't be more deaths, but we've reached a saturation of control. We're still not quite there yet.
Thank you for that clarification. In my next question, you've touched on this already because it's also blended, right? But if you have anything to add, EDGE prioritizes career tech education, pathway programs, and earn and learn opportunities. How do these priorities align with CHA's priorities? And how are these education and training opportunities leading to good jobs in healthcare?
Sure. Well, let me start with the last. We know that healthcare jobs are among the best jobs out there, right? They're high pay, they're good benefits. So we want to encourage people to continue to choose healthcare as a job opportunity. But especially as we look at this pandemic, at the loss of 20% of the healthcare workforce, we have to rethink what that work looks like, how we aid and assist with the use of technology, and even how we rethink that work in a new technological era. Some folks have said the pandemic really fast forwarded some things that were trending along already. Think retail, right? Fewer people going to stores, you bought everything online. Things like food apps, right? Everybody door dashed, and that just took off. We have to think about the same in terms of the transformation of healthcare work itself. How do we make that work less physically taxing? How do we make that work less mentally taxing? How do we employ technology and telehealth and televisits into how we provide care, not just at home, but in the hospital as well? And so we're going to have to take a limited number of people and stretch them more than we've ever stretched before. But the use of technology in that, I think, will be a necessary change. We also look back now at our need to employ travel staff. Used to be something we did when there was an immediate short-term need. And now what we realized is everybody was using travel staff and we didn't have enough. But we've got a whole new group of workers who like the idea of traveling and moving around to different organizations. It might be the Uberification of the healthcare workforce. How do we harness that? How do we meet those workers' needs for change and a new environment while also continuing to ensure quality and patient safety? So we have tremendous opportunities. I think the future is here much sooner than we thought.
Yes, absolutely. And again, the next question, just wondering if you had any more to add, but we've covered a little bit of it. What do you see, or if there's any other huge challenges that you're facing or your members are facing in recruiting and retaining your workforce that the healthcare sector absolutely needs to keep us all well? And how can state policy and investments address those challenges?
Great questions. A lot of people are talking about the great resignation, and it's not just in healthcare, it's in other sectors of the economy as well. The problem with the great resignation is it now creates, right, the battle of talent. So healthcare organizations, hospitals in particular, are really going to have to take a look inward to say, what can we do and what can we do differently to attract people into healthcare, because lots of job openings right now, lots of places people can go. And working at the bedside has been exposed to be very, very challenging. So I think we have to look at what we can do to make that environment as safe as possible, as non-violent as possible. We've seen an increase in violence within healthcare settings. And I think it just goes to the frustration that many are experiencing as a result of this pandemic, the isolation and all of the rest. But we need to protect and care for our workers. But these are also jobs with tremendous opportunity for advancement. What can we do in terms of public policy? We need the state and the federal government to provide the funding necessary for increased numbers of faculty positions within colleges and both 2 and 4 year schools to educate more. We need the funding so that healthcare settings can provide more training slots and opportunities to those students. That was a real challenge during the pandemic, when we really wanted to limit exposure for many. And we need to look at some creative, I'll call them broader economic opportunities, things like creating health enterprise zones. Think of this as communities who could come together and offer tax credits or housing vouchers to workers who are interested and willing to work in those communities. So I think it's a series both of investments and removing barriers to those who want to work in healthcare and work especially in some of our more vulnerable communities and communities of color, which have had long-standing challenges in recruiting healthcare workers.
Absolutely. And I just want to let you know how much I appreciate your approach. Every remark you've made has been a person-centered approach. The workers, serving the people, health, not a system. And you represent systems, but it all starts with the people. So I just want to let you know how much that resonates with me, and I know that it'll really hit others as well.
Well, thank you so much. And it is what hospitals are here for, right? We're not just buildings. We're not brick and mortar. We're places where caring and curing happens, and that doesn't happen without people.
Yes, 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 yes. So as you know, CHA has been a member of the EDGE Coalition, and the coalition includes leaders in education, social justice, business, workforce development, and labor. What do you see as the benefit of this coalition approach to advance our shared priorities?
I think it's critically important. Big things in California don't happen unless stakeholders are working together. Lots of things we might disagree on, and then they're left on the legislative floor, right? It's only when we come together, and there has been no greater opportunity than today for healthcare providers and labor and educators to join together. We all agree on the objective. We need more students trained, more workers available, and more care to be provided. We have never in our history had more people in need of healthcare and fewer people available to provide that care. So this is one of those rare moments where our interests are fully aligned, and we need to look to state and federal government during times of a pandemic to come through with the investments needed to shore up our healthcare system for the future. And as you know well, not just because of the patient care we provide, that's critically important. But if we don't shore up the healthcare system, we are jeopardizing jobs in the future. And we've got to make certain that we don't do that either.
Yes, I appreciate that so much. When the pandemic first started, of course, we had to focus our attention on the right now, the response and the recovery right now. But now that this has gone on, we have to shift our approach to the long term. And so I appreciate what you said. That really resonates. That was very, very heavy. And we always like to lighten it up and wrap with a fun personal question. So
Great.
more fun personal question is, it's winter, albeit California winter. I know you're not from California, so it's a little different than when we're moving back east. But what springtime activities are you looking forward to?
Oh, what a great question. You're right. I grew up in Minnesota, so I grew up with really cold winters. The winters here are so beautiful. But my springtime activity, I am a brand new gardener. I sadly have killed many a thing already in the garden, but I am looking forward to, this will be my third year trying gardening. I'm looking forward to trying some new things, both vegetables and flowers, and seeing if I can keep everything going this year.
I love that so much. So we're gardeners over here too. So maybe we can arrange to swap some goodie bags as
That sounds great.
I love that. I love that. You know, it was great to spend some time with you today, Carmela. Thank you so much for joining me.
Thank you for all that you do. We so appreciate it.
And I'll see you next time on The Cutting Edge.